cervical flexion range of motion. You're going to have your patient in a sitting posture, and you've got the stabilization of the chair. They should be in a firm surface. Your axis of rotation is going to be the external auditory meatus. Your stationary arm is going to be perpendicular to the floor, and so you really need to make sure that it stays upright. And your movable arm is going to align with the nares of the nose. And so you're starting and you're really using the 90-degree angle here. So this starting, you're going to be using the red numbers to do your reading. And you ask your patient to go ahead and look down to the floor for me, as far as you can. Now, if you notice, this external auditory meatus moves. You can come back up into neutral. Okay. So I start out here, and if I place my goniometer here, the patient flexes forward again, and you can see my axis of rotation is now way down here. So what I have to do is I have to move the goniometer along and realign it with that external auditory meatus. I want to make sure that my stationary arm remains perpendicular, and go back to the nares of the nose. And when I read my goniometer, then I have 50 degrees of flexion. The key thing here is what happens a lot of times is people move this arm forward. They'll also start to move the stationary arm, and so they end up reading like this. You have to take a second before you take that reading and make sure that that stationary arm is in that perpendicular position here. Once I've read my reading for active, now what I'm going to do is just gently move it a little bit farther for my passive range of motion. And she increases to 55. And then I want to give a gentle overpressure to feel that end field, and come back to neutral. So with that end field, you want to take them a little bit farther beyond that physiological end. Remember, people can be very irritated in the cervical spine, and so we don't want to push too hard. And we want to be gentle. Now, if someone was very, very irritated, if someone is coming in with very active symptoms, I probably will not do the end field. Right now, we're working with people that have no dysfunctions and no pathophysiologies, and so we're checking the end field, but be aware this is your clinical expertise and your clinical reasoning as to whether or not, A, you really think a passive range of motion is necessary, and definitely also with whether or not you're going to do that end field. Before we move on to extension, again, I want to show the stationary arm up here, and if my patient can flex forward again for me. So she brings her chin to her chest, and go ahead and come on back up. If I'm reading, this is where a lot of students get confused. So if I'm reading the block numbers here, they'll say, oh, they have 150 or 30 degrees of range of motion, which is incorrect. Remember, I'm starting from here. So really, I'm using the red numbers on the outside. For extension, we're going to be using the same landmarks with the external auditory meatus and the stationary arm in a perpendicular to the floor. And we're also looking at the nares of the nose. And we're going to ask our patient to look up towards the ceiling for us. Bring your head back, look up towards the ceiling, and you can see she's got quite a bit of range of motion here. And I really don't want her holding in this position for a long time because this is uncomfortable. She's got 72 degrees here. I'm going to go just a little bit more. She has 76 degrees. And now my overpressure, very light, and go ahead and come on back up. And this is firm overpressures for both. Flexion, the normal range of motion is 50 degrees. Extension, the normal range of motion is at 60 degrees. You may often see a lot of times at 70 to 75 degrees of range of motion. And as I said, just be careful with the overpressures and also with not having your patients be in those positions for extended periods of time. Of course, I would be standing in front of the patient and doing these measurements, for the video purposes, I'm off to the side. Side bending or lateral flexion. Our landmarks are C7 as my axis. So I'm going to determine where C7 is. If I don't think I know where I'm at, I can palpate all the spinous processes and ask my patient to look up towards the ceiling and find one. Go ahead and straighten it again. That does not disappear. There's C7. My stationary arm is going to be aligned with the spinous processes of the thoracic region, and my movable arm is going to be aligned with the midline of the head, and I can also find the occipital protuberance, and that is where I'm going to line up my movable arm. Now, one of the things I want to note here, and we're going to be doing this a lot with the other ranges of motion, is I don't have my goniometer directly against my patient. So normally if that happens, that ends up being curved in this position. I'm out a little bit so that I can keep my goniometer in a straight up and down position, and I'm just aligning it with these different landmarks, okay? So we don't really have to have the goniometer completely pressed against the patient's body as we're taking these measurements. So C7, spinous processes, occipital protuberance, and we're going to ask the patient to bring your left ear down to your left shoulder. And we're going to take our measurement here. And then we're going to do some passive range of motion. And then we can put the goniometer down for a second because we need to do our end feel, which is a firm end feel. Back up to the middle. Again, this is a very gentle. We're not pushing hard. We're also not bouncing. So we're not doing this bouncing at the end feel because that, again, is not comfortable. And bring your right hand down your right shoulder. Keep that in line with the occipital protuberance. Remember, double check your stationary arm that that's in the right position. Realign your landmarks. And then we're going to do the passive range of motion. And then I'm going to give overpressure. And what I mean with overpressure and not bouncing is you don't want to take them to that end range and give that overpressure and then sit down here and do this at the end range. That you're banging their facet joints together, and that is not comfortable. So when we're doing our end feels, especially in the cervical spine and the lumbar spine, we're just going to give that nice little extra stretch at the end range. Cervical rotation is done typically with the patient is sitting. Again, the chair is stabilizing them, and we are utilizing the goniometer from the top. Now, you may have to get up on the table behind the patient. Of course, you want to be very careful when you're climbing up on different equipment if you can't see directly down if you're too short. So in this case, our axis of rotation is going to be an imaginary line down through the midline of the head. Our stationary axis is going to line up on an imaginary line between the two acromions. So we're going to have to make sure that we're looking down, and our movable arm is going to align with the midline of the nose. So we are starting at the 90-degree motion, or the 90-degree position with this goniometer for rotation. And we're going to ask the patient to turn and look over the right shoulder. And we're going to follow that motion with the goniometer. Remember, double check what your stationary arm looks like so that that hasn't moved as well. A lot of times people are moving both of these. So you have to realign there. Make sure that I'm aligned here. We have 85 degrees. Now this is a little bit more difficult to do the passive range of motion. So now I'm going to do a little passive range of motion. She can go a little bit farther. I can set my goniometer down. Very gently put one hand on the forehead, one hand on the back of the head, and do my end feel, which is going to be a firm end feel. Realign. Access through the imaginary line through the middle of the head. Stationary with the imaginary line between the acromion. Turn over your left shoulder for me, please. And we have 72 degrees of range of motion. And then we're going to do a passive motion. Make sure everything is realigned. And she is at 78. Again, my positions for my hands, one's going to be on the forehead here, so that my motion is this when I'm doing my end feel. So I'm going to come in here, take her to where I can feel all the way that end feel took all the slack up, and give a little extra push at that point. And I'm looking for a firm end feel because of the ligaments and the muscle tightness. So again, with that end feel, whenever you're doing end feels, you want to make sure that you're taking up all of the slack, you're going all the way to that physiological end range and just giving a little stretch at the end feel. We can also do cervical flexion and extension with inclinometers. We can use either a single inclinometer or the dual inclinometers. If I'm using a single inclinometer, it's going to rest on the top of the head, and I'm going to zero out in this position, and then I'm going to ask the patient, bring your chin to your chest and look down at the floor for me, and I move that along with, and I'm going to take my reading at that point, come on back to the middle, and then I'm also going to ask her to look up towards the ceiling, and I will take my reading at this point and come back up to the middle. With dual inclinometers, what I'm doing here, because as she flexes or extends, so she brings her chin to her chest, I'm getting that motion that is going all the way down into the thoracic region. So I'm really getting more cervical thoracic range of motion than I am pure cervical range of motion. Come on back up to neutral. So if I truly want to isolate that, I really need to use dual inclinometers. So the first inclinometer is going to go at C7, and remember how to find C7. Remember, if you palpate the sinus processes and have the patient look up towards the ceiling, look up for me. C7 is the one that does not disappear. That's where I'm going to place my first goniometer, and I'm going to zero it out in this position, or inclinometer, I should say. My second inclinometer is also going to go on top of the head, like we did with the single inclinometers. And now I'm going to ask my patient to look down towards the floor, let their chin down as far as you can. Now both goniometers or inclinometers are going to move. So if I read 45 degrees on the top and 5 degrees on the bottom, come back into neutral, we're actually going to subtract those two, and what we're getting is 40 degrees of pure cervical range of motion. When using dual inclinometers for extension, we're going to be doing the same thing. However, now if I have my goniometer here at T1, if my patient extends, if she looks up towards the ceiling, her head's going to run into my goniometer. And so what I really need to do is I need to do kind of this false positioning, and I'm going to line it up initially and zero it here, but then I'm going to actually come out a little bit to the side. So as my patient extends, go ahead and look up. She's not running into that goniometer, and I can get that full range of motion. Back up. So we're going to have these two goniometers or inclinometers zeroed out, and we're going to ask her to look up towards the ceiling. Take my two measurements, and I'm going to subtract the difference to get my actual cervical range of motion. Using the single inclinometer, we're going to place the inclinometer on the patient's top of her head, and we're going to zero in this position, and then we're going to ask her to tilt her left ear down to the left shoulder. And I'm going to take my reading in this position, come on back up to the middle, bring the right ear down to the right shoulder, take my reading in this position, come back to the middle. We would also do passive range of motion and the end feel utilizing a single inclinometer. For the dual inclinometer, we're going to, again, find C7, T1, and we're going to place one inclinometer here. Again, we can't really lay the inclinometer down against our patient. That puts it in this position. So typically what I will do is hold the inclinometer in my fingers like this. So I'm holding it in a very straight up and down position. The reason you can't lie it down is now the fluid won't move properly in there. You know, once you start getting into this type of position, it needs to be upright. So I'm doing this kind of artificial here, but I still have it lined up properly. And I'm going to zero on the head and zero here in the thoracic spine as well. Ask my patient to bring her left ear down to her left shoulder, take my readings, and subtract the two numbers to get my pure cervical side bend. Come back to this. And so now in this position, I can rest the inclinometer on the patient's forehead. I can set my zero in this position, ask her to look over her left shoulder, take my reading there, come back to the middle, and then have her look over the right shoulder, and take my reading in this position as well. Come back to the middle. So this is the CROM, which stands for cervical range of motion. And it has been shown in research to be really highly validated and reliable. In fact, it's probably the best and most accurate way to take a cervical range of motion. The thing is that a lot of people don't have access to these in the clinic. And when you work with the CROM, it's going to come in two different parts like this. And what you're going to see is it basically has built-in inclinometers. So it has a built-in inclinometer on the side, and this is going to be for flexion and extension. And it has a built-in inclinometer on the front, and that's going to be for lateral flexion. And then there is a third component to this, and this just slides into the top here, and that's going to have a third inclinometer, and that one is going to be for rotation. Now, in this position, basically the inclinometer on top is a magnet, and so you zero it. You can either use the Earth's gravitational, or what you'll have is this other component here, which you're going to place on the patient's, around the patient's neck, and you see that it has north. So this is basically a magnet, and this will then, kind of hard to see, but it is moving. If you can see there, it is moving the dial on the top because it is a magnet, and the one on top is basically a compass. And so you put that around the patient's neck, and then you would zero it out with that. So that's what helps to zero that out. So with this item, basically you put it on the patient. You're going to rest their nose here. They can't be wearing glasses or anything during this. Put the sides over their ears, and then strap around the back of the head, and go ahead and take your measurements. We now have our patient set up with the CROM in place, and so we've got our magnet placed here on the bottom, and so we want to make sure that we align our rotational device and zero that out before we get started. And this is nice because we don't have to move around or ask the patient to be in different positions. And so the front one is the one where we're going to do side bending with. And so we're going to ask our patient to tilt her right ear down toward her right shoulder. And we have 50 degrees of motion here. Come on back to the middle. And then we're going to ask her to bring her left shoulder down. And we have 58 degrees. Come on back up. And then for rotation, she's also going to be in this position. And we're going to ask her to look over her right shoulder. And we're going to be going out of her from this position, back to the middle. Turn look over the left shoulder. And we're going to be going out of her to this position and come back to the middle. For flexion and extension, we're going to be using the goniometer, the inclinometer on the side of the CROM. And so we're going to ask our patient to look down towards the floor. We're going to read here, we're at 50 degrees. Come on back up. And we're going to look up towards the ceiling. Good, and go ahead and look forward. So the CROM has been shown with research to be the most reliable and valid when it comes to measuring cervical range of motion. However, a lot of clinics won't have the CROM available. It is not inexpensive, but if you do have one that is available, it is best to use that if you want to take very accurate measurements.